So today we're going to talk about undermethylation and why it's so important in psychiatry. And I thought we could talk about what it is, what the symptoms are, what diagnoses are associated with undermethylation, and how we evaluate and treat, and also a number of the controversies that relate to undermethylation. To start, we should reference Dr. Walsh's book, has a nice, very in-depth explanation, and that's Nutrient Power. But do you want to talk about a little bit about methylation, and we can also talk about what it does in the body, why it's so important?
Methylation is a biochemical process that takes place billions of times a second in the body, and it's involved in many, many different processes. So it's involved in protein synthesis, it's involved in synthesis of neurotransmitters, it's involved in detoxification. And so since it's such a fundamental process, when it's not working well, it causes a lot of symptoms for patients.
Specifically, toxicity would cause a lot of brain-related symptoms.
As well as synthesis of neurotransmitters.
Right. And then even high histamine, which is something that methylation is required to break down.
Right, and that's responsible for a great many symptoms and a great deal of suffering.
Right.
So methylation is a very fundamental process for brain health.
I point out which diagnoses specifically we'll see with undermethylation, and we can get more into the statistics later, but depression certainly being one.
Right, severe depression, anxiety is related to
ADHD.
it. Absolutely. Memory problems,
Right.
cognitive problems.
Even psychosis for some people with delusions.
Right. It's also related in autism.
Right, and dementia, as you pointed out, with memory issues.
Yeah. So it's a very key player in so many different conditions that we see.
Right, and I would say most people we see with brain-related symptoms are undermethylated. At least when we originally learned of this, it was that 30% of the general population had a methylation imbalance, be it under or over methylation, but most of those were under methylation.
Right.
And so not necessarily having to have psychiatric symptoms, but in the psychiatric population, I believe it was 70%, with 55% being undermethylated, 15% being overmethylated.
Right, but now Dr. Walsh is saying that for some reason this has changed, and we're seeing much less overmethylation than previously.
Right, right. The other thing that I think we could point out about methylation is how within families, it's not only affecting brain-related health, but we'll see families with undermethylation having higher cardiovascular illnesses, such as strokes or heart attacks, more cancer.
Which is intimately related to the detoxification piece.
Right, exactly. And you probably see this too when you do a family history. I mean, that very commonly we're seeing cardiovascular disease and cancer in the patients that we see in their family histories.
Yeah, that's really true. And a person can have a methylation problem not only because that's the genetics that they were born with, but it can also develop as a result of trauma when there's something that changes a person's genome epigenetically through the environment or a traumatic event. Then they can also start to have methylation problems.
Right. And I think from the cell danger response that I know Dr. Nathan talks about, when there's a microbe that shouldn't be there on board, that methylation will shut down as a way to keep the body from allowing that microbe to reproduce. so that microbes can also shut down methylation.
Mhm.
And then candida specifically, I think, makes a toxin that will inhibit methylation cycles.
Mhm. Right, so there's many different ways that a person, it can be both inborn or acquired. And the acquired can be because of environmental toxicity, but also because of stressful events.
Right. And would you agree, Judy, that almost culturally we're becoming more and more undermethylated? If you think about just our toxicity, um, our microbiome, our trauma, that in some ways evolutionarily we're kind of shifting in that direction, not
Right.
not
So
necessarily for the better, but
I also wonder about the effect of electromagnetic frequencies, because that also affects the microbiome, and we're certainly being exposed in a way that never before was the case. And I'm not sure about specifically the effect upon methylation, but given what we're saying about how it affects the microbiome, that and an inflammatory response, that
Mhm.
seems likely to me that it's also a player.
Right. And I think Dr. Walsh talks about how insults, will impact the the epigenetic expression of methylation genes. So we could point that out too, that there's multiple genes that affect methylation.
Right.
And it's kind of the balance of those in terms of which direction we may fall on that spectrum. So if someone might have the vulnerability, but then they could have an insult that tips the scales in the direction of undermethylation.
Right.
So I think your point about EMF, that could be an insult, just like someone having a bad hit of, some drug that tips them into a different place.
Right. Or exposure to chemicals. I mean, the other thing to point out is that because the genes are so big and things are so complex, and there's an epigenetic piece, that it's a mistake to think that because you get genetic testing and that you're homozygous for MTHFR, that means necessarily that you have a methylation problem.
Right.
And
So we should point it. Oh, go ahead. Go ahead.
the
I'm
way that
sorry.
we try to determine that is through measuring whole blood histamine levels, because there's an inverse relationship between the functionality of methylation and histamine levels. And so people that have high histamine levels are undermethylated.
Right. And so MTHFR is one gene, and it's the one that gets all the media attention.
Right. And
But
I
there's
very often
there's
have patients call
many.
and saying this whole alphabet soup of different genetic mutations that they have. And it really, in my mind, is not that relevant. Like, I'm much more interested in seeing the biochemistries.
Right, because we don't know how much those genes are even being expressed. So that when we talk more about controversies later, we should get back to that, because even within the functional medicine community, there's debate on how much we should be relying on what we call SNPs or mutations
Right.
in
Right.
these various genes. We should comment, for anyone listening who's wondering, gee, could I be undermethylated? What character traits and even maybe some physical symptoms that they might have that would reflect that they're likely undermethylated. And I should say most physicians are undermethylated. I think Dr. Walsh can say 90. And I know that I'm undermethylated
Mhm.
through and through. Um, and so do you want to list some of those and we'll go
Yeah.
from there?
Well, a person who is undermethylated is often very detail oriented. Sometimes they can be obsessive in their thinking.
Mhm.
Um, some of the people who are undermethylated can be competitive, more so than average. They're prone to having seasonal allergies.
And strong-willed and
Oh, yes. Oppositional sometimes, not liking to follow instructions or directions.
right, and real sort of black and white thinking.
Sometimes, yep.
And two, we should point out there's most people we see don't have all of these, but these would be things that we would be listening for.
Right, right.
And I do think it's interesting how even the way someone might present themselves, or when I used to have paper charts, how someone would fill out, even their handwriting. If it was especially neat, that might make me wonder right off. Or in the questionnaires.
Perfectionistic, right? Like
Sure, right.
so attentive to detail and all inclusive, not wanting to leave anything out. And
Exactly. So the very long explanations on the histories we might do
yeah,
would point to that. And two, we
high
should
speed,
mention,
like wanting to have it be like really, really good.
right.
Even the history filling out.
And it can be that when is it perfectionism, like fear of not doing something right, and when is it like striving for excellence? So
Right.
some undermethylated individuals are thriving, but
Right.
some are bogged down.
About doing a good job. I mean, that's an adaptive quality, but it can go over the top.
It is the most common biochemical imbalance that we see in depression. And the others being pyrroles, elevated copper overmethylation, metal toxicity. And as we know, though it's not factored in, there's plenty of other toxicity like mold toxicity, mast cell activation, other things too that aren't necessarily in those Walsh breakdowns.
Right. I mean, I think that's something that has impressed both of us, that many different experts have like a piece of the puzzle, and their piece is very important, but it's not the whole story. And so like if a person is just like taking the nutrients that one prescribes to treat undermethylation, it often is not enough if they're not attending to their stress or to their diet or to all kinds of other factors, and approaching what's going on holistically. Methylation is a piece of the puzzle.
Right. And that, I think when we get to the controversies, we should talk more about that in terms of the timing. Because if someone suspects that they're undermethylated and then they just go to treat with certain nutrients, many people won't be able to even tolerate those nutrients if they have some other things going on, which is more often what we see than not. And in fact, I think it's when there's something else going on that the additional toxicity and the additional high histamine, maybe from mast cell issues, that are taking things to a different level where it's really impacting their functioning.
Right.
But undermethylation alone, I'm not sure how often I see that.
No, it's a piece of a larger puzzle that needs to be addressed.
So we should round out some other symptoms. I guess dietary inflexibility, which could relate to an eating disorder.
Inflexibility in general, just rigidity.
Right.
Like having to have things be a certain way.
People that are undermethylated tend to be thinner. You talked about allergies, and was there anything? I mean, Walsh mentions a few, like more fluidity, like watery eyes, or more saliva, a higher libido, which I think is associated too with histamine levels.
Sometimes people feel depressed in the springtime.
Right, that's what I was just going to point out.
Yeah. That can be a cruel contrast between the beauty of the springtime and feeling down.
Right. I don't know the study, but they looked at the incidence of suicide in the spring, and they didn't pin down why that was, that there was a higher incidence, but they were relating it to allergies.
Mm-hmm.
And I would, like the way we would probably look at that is those people that are dealing with allergies are people that are undermethylated and going to be the people that are more prone to depression.
Right, because the fact that they're undermethylated means that they can't break down the excess histamine that is triggered by the pollen and all of the springtime.
Right. Right. So anyone that's had like bad flu and had that sort of fatigue and brain fog and feeling even hopeless or things aren't going to, just feeling really down, they can imagine what that would be like to have that somewhat persistently for someone that is undermethylated, and not just because of the histamine. I mean, we should point out probably more specifically the impact on neurotransmitter activity and how people that are undermethylated, because of the expression of receptors for serotonin, will have lower serotonin activity and thus more depression.
Right, and remember Dr. Walsh saying that people who have like a very good response to SSRIs are often people who are undermethylated. Those serotonin reuptake inhibitors. By contrast, the overmethylators often have a really adverse response to those medications.
Certain groups that are more prone to depression and even suicide, for example, physicians, that's known that physicians have a high rate of suicide relative to the general population. And, from what we know about methylation, that would seem expected, that there would be greater depression in physicians, even in dentists too.
Yeah, that they have a really high suicide rate.
I don't know what it is for accountants and engineers, but those would be other populations that would
very
fall into the undermethylation.
That need to sustain effort over long periods of time and be very detail oriented in order to succeed professionally.
Right. And Dr. Walsh doesn't talk about this being left versus right brain, but the book by McGilchrist, The Making of the Western World, and it's about both hemispheres and all the studies. And I mean, he's really collected all the research on this idea of left and right brain. And across the board, left brain is undermethylation symptoms. And so I can't help but wonder how methylation affects, structurally affects this leaning in one direction of.
Well, that's really interesting because,
way of experiencing the world.
Right. I mean, left brain experiencing of the world is not like a spiritual experience. It's not like a feeling of connectedness and expansiveness. It's much more, the focus is sort of honed down. And, in our current culture where people are very cut off from nature and also are constantly consuming media and always listening to something, like there's no time or no space for that kind of experience. And I'm wondering if it even drives undermethylation in a certain kind of way, or is sort of a mutually reinforcing kind of thing.
The argument of McGilchrist's book is that we're becoming increasingly left brain, and for all the reasons that you've cited. And so, yes, could it be that we're becoming more undermethylated and that's making us more left brain, or are we becoming more left brain and that's shutting down methylation, or both?
Well, whatever it is, it's not a cycle that leads to a lot of happiness.
No, right, because the right brain is where we can pull back, see the big picture, have that more expansive thinking,
And
more
good
empathy, compassion.
to others and all that is.
I don't know that Walsh has broken this down, but I would suspect, for example, he has identified antisocial personality traits as being consistent with undermethylation. So when they looked at sociopaths, they were overwhelmingly undermethylated, which would fit
Also
with the
high
lack of.
pyrroles, right? Like really high pyrroles.
Right. And he doesn't have like narcissistic personality disorder, but I would suspect that would fall in the undermethylation realm. You know, this sort of detachment. And I want to just read from Dr. Walsh's work because I think it's worth. So he has 98% of those on the autism spectrum, 95% of those with antisocial personality disorder, 90% of schizoaffective disorder, 85% of those with oppositional defiance, which that particular diagnosis is, I think people are avoiding using that so much, but to me, it reflects a type of anxiety that's manifested differently.
And a kind of rigidity, that makes it so that there's just a need to control in a big way.
But 62% of those with anorexia and 38% of those with depression, which again is the most common biochemical imbalance. And not mentioned in Walsh's work is, but more within the functional medicine community would be chronic fatigue. I mention it because the treatment is seemingly different if somebody has a preponderance of physical symptoms versus brain-related symptoms.
If a person has a lot of depression and anxiety and seem to fall in the undermethylated camp, we avoid folate in terms of the way we've been trained by Dr. Walsh, that it makes things worse.
And the way that we've been talking about undermethylation is from that perspective of brain health, right? Because there's lots of people that may not have depression and anxiety that are dealing with the consequences of undermethylation.
That's true, although it seems like there are more and more people who are dealing with depression and anxiety, as we were saying these days.
Right.
Not because of the coronavirus, but preceding that with the collapse of the biosphere and just people generally feeling a sense of big anxiety about the future.
Mm-hmm. Right, because you'll hear in functional medicine people saying undermethylation, you need folate, B12, and then what we're saying is not so fast, that people with undermethylation, while in some ways it could help with detoxification, it could worsen their neurotransmitter activity and make their depression much worse.
Yes.
So I think even for us,
in my practice, where somebody comes to me and they have seen other practitioners previously and conventional psychiatrists who prescribe high doses of folate. I think there's a medication called Deplin, and it really has made them much worse.
That is where conventional medicine, this is kind of where we meet, because that's where they're using a specific nutrient to help with brain-related symptoms. But from our standpoint, it's the opposite of what we would be recommending.
Right, right.
So that is a big controversy that's out there. And another is, even within the functional medicine community, is that very often people that are seemingly undermethylated are given folate to help promote methylation pathways. There's many people in the functional medicine world who are going right to treating methylation, or they're identifying SNPs, these mutations, and then basing treatment based on the mutations that the person has.
Right.
And so that's another debate and people that are listening will hear different opinions on these different issues.
But as we said previously, that's not the way that we approach it, and that we
Right.
like to look at the blood chemistries in order to determine what's the appropriate approach and treatment plan.
So that could be the whole blood histamine, and it could also be a methylation test that specifically looks for different, it's a blood test also that looks for different methylation measures. So SAMe, SAH, cysteine, homocysteine. And then the symptoms, as we've pointed out in our last talk, often we know who's undermethylated before we do those tests.
Right, we have a high index of suspicion just by what
Right.
the clinical history.
What we don't know is if someone has a high homocysteine. And so that's something, at least for someone older than, I mean, the age at which I check it is coming down, but at least 30. And if it's elevated, we wouldn't be able to treat methylation.
Homocysteine seems to be a measure of oxidative stress and inflammation, and that needs to be addressed with certain nutrients before you can initiate a protocol to treat methylation. Otherwise, you exacerbate the problem.
Right. And what we would consider normal would be, so cardiologists will sometimes order this as a cardiovascular risk marker, and the labs range will have above 15 as elevated, and we would want it below 10
Right.
before we would treat someone for methylation. And the way I try to explain it to patients is that these cycles, if it's not flushed out, then sorry, my dog is jumping on me. If it's not flushed out, then when we treat methylation, it will start to back up. It's again a reason why we rely on the testing that we do.
Right. Right.
And do you want to comment on how we treat methylation strictly from a Walsh standpoint?
Right. So we use antioxidants and minerals. I had a conversation, and SAMe or methionine is a very important piece of the protocol. But I had a conversation with Dr. Walsh very recently. I was consulting him about a patient, and he was talking with me about the use of NAC, which it helps the NMDA receptor. That's a receptor where glutamate causes excitation, and undermethylation seems to increase the activity at the NMDA receptor, and NAC helps modulate that and seems really helpful for patients who are undermethylated. And that was something that was a new piece for me, that was something that we talked about when we trained with him in 2014.
Mm-hmm. And it would, I mean, it being a precursor for glutathione, and ultimately that's one of the things that methylation helps with detoxification by creating glutathione. So it's interesting that it does both. You know, it's important for making glutathione, but you're describing another.
Right. It's so, and you know, like that glutamate, like I know for myself that if I am exposed to monosodium glutamate, that I can forget about sleeping. You know, like it just really revs me up. And that's like the excitatory capacity of the glutamate as a molecule. And that receptor, when it's overactive, which it is when people are undermethylated, then it's contributing to psychiatric symptoms in a big way.
Right. Right.
So now that's part of something that I recommend for all of my undermethylated patients.
Mm-hmm. And it would too bind, I know we use it to bind gliotoxin, which is a mold toxin, and there's debate as to whether if it's also a yeast toxin. So
Right.
NAC could be helping with mold toxicity, methylation, the NMDA receptor.
Right.
And
That
in
the
conventional,
ADHD is involved in all kinds of neurodegenerative problems. Like people who have all kinds of neurological diseases have overactivity at that receptor, and it's involved in memory function, poor memory. Um,
right. And you'll see in conventional or allopathic psychiatry, they're starting to use it in different ways, um, for different disorders, but I don't know specifically that they know what they're targeting,
mhm.
but that they found it to be beneficial.
Yeah. No, I think it's really has a lot of positive capacity to
Hmm.
help
Right.
a variety of psychiatric symptoms.
So we talked about some of the debates, and I think we should talk about folate in pregnancy because that's often a big question.
Mm-hmm.
Um, and in the last year, because of a Harvard study where they associated folate in pregnancy with a higher incidence of autism, I think that's brought this issue back to the forefront. And
So interesting, isn't it? I mean, that was just like a standard recommendation. It seems like it's so often like that, but these standard recommendations then turn out to be like really causing a lot of problems.
right, and the standard recommendation was the first trimester, but then it's one of those things where, well, if it's good for that, it must be good, for the whole pregnancy, and beyond. And now the question has become, is that not knowing the methylation status of the baby, given if they're undermethylated and therefore potentially higher in folate, or even before that, how is their DNA expression being impacted?
Right. And I mean, it should be mentioned that Dr. Walsh does not recommend using the nutrient therapy protocols in pregnancy. It's just
Right.
so complicated that, with the maxim of like do no harm, it's not indicated to use those protocols,
Hmm.
high doses of nutrients in pregnancy.
At this point, I'll recommend people follow the CDC recommendations in terms of the first 3 months folate. And then beyond that, I'm giving them information from the Walsh Research Institute and Mensa's work that talks about the potential impact on the baby that we just don't know.
Mm-hmm.
So is there anything else that you can think of that we should?
Well, just emphasize that testing for undermethylation and treating undermethylation, while very useful and important, is only like a piece of the puzzle, and that there are a number of other approaches that need to be implemented, particularly diet and stress,
Right.
and avoiding toxicity if a person is going to feel better.
Right, because the diet, if your microbiome is off, then getting a lot of toxicity from the microbes and whatever you're eating, then if you're undermethylated, you can't get rid of those toxins very well. And then if you have the inflammation from the microbiome, you can't break down the histamine particularly well.
Right.
So I always feel like people that are undermethylated are like the canaries in the coal mine. Like they're the ones that are going to be symptomatic first from what everyone's doing.
Right.
And we should mention diet specifically for undermethylation is not necessarily a high folate diet from a Walsh perspective.
In avocados and in leafy greens, but I also wouldn't recommend like totally leaving them out.
No.
I mean, people have to
Right.
figure out for themselves, like if they have a bad reaction to any particular food. But if you're undermethylated, green smoothies might not be the best plan. But just to a wide variety of
Mm.
vegetables as well as a whole foods diet, organic,
Right. I'm
non-GMO.
usually recommending if people, if people not take out the vegetables, but start replacing the carbs with protein,
Yeah.
as a way to be increasing their protein, but also lowering the carbs. And then I'm with you in terms of I don't want people to start just going on a meat-based diet because they're avoiding vegetables.
But undermethylated people do well with animal protein, and that is also an important piece. And I have had a number of patients who have shown up in my practice on a vegan diet, and it's really had an adverse impact on their mental health. And I think, it's related to their methylation. It's aggravating the situation.
Right. That the methylation, and then they also tend to be low in zinc because they're not getting.
Oh, zinc is important for methylation, very important.
Mm-hmm. Lastly, and again, this is where I'm weaving in not just Walsh's approach, but for people with chronic fatigue or people that we see with mold toxicity, there's often the timing of methylation treatment that we're often having to forego it for a while we address toxicity or other issues,
right?
Because they simply can't tolerate
the nutrients,
the SAMe or the
zinc,
or even the B12, methyl B12. They might be able to tolerate a different form of B12, but that there's a timing,
right?
And partly because I think of this cell danger response.
The answer is not folate for everyone. So each patient is different, and to definitely, like, my approach is, like, if it's making you feel unwell, to stop it, like
right.
not muscle through, or to
listen to the body.
Yes. Yeah.